I am Leah Hansen with Rhythmlink, and I'm excited to introduce today's presentation highlighting the benefits of the Guardian needle, designed to deliver a safer needle to you and anyone who uses a subdermal needle to care for patients. Today, you will hear directly from the healthcare providers, bringing real-life examples where the Guardian needle is safeguarding their well-being by reducing the risk of accidental needle sticks and injuries. All healthcare workers face risks in their daily work, and this can be both in the forms of physical and psychological risks. Arguably, one of the most dangerous areas can be in the surgical suite, where patients are at their most vulnerable, and the healthcare providers are using devices that can introduce significant injury risk. One of the most common devices used is, of course, a needle. And during the course of surgery or any other medical work where needles are used, needles can be placed all over the body. This can introduce a risk literally from the top of the head to the tip of the toe to the care providers at bedside and working on and within that patient's care. These risks and challenges can result in staff shortages, impact on quality of care, and strain the entire healthcare system, not to mention the personal impact that it can have on the healthcare provider themselves. When an injury occurs, the provider can be exposed to a variety of bloodborne pathogens, and these injuries can and will result in time-consuming and very costly post-exposure protocols, impacting the provider and the efficiency of the service. Now, until recently, there was little protection or real strategies to significantly reduce the needle stick risk. That is until the introduction of the Guardian needle. The Guardian needle introduces a design with innovation that brings tangible, real value to the healthcare system by reducing that risk of accidental needle stick and finally providing protection to the healthcare team that is long overdue. Welcome to the presentation on Guardian Needle.
We are here today at Children's Hospital in Charleston, South Carolina, with the experts in the neurosurgical team to discuss the Guardian needle. We will discuss today the benefits of this safety needle during their OR cases, both in ortho and neuro, in hopes to better educate the public on these safety needles in discussion of bloodborne pathogens, as well as the policies and procedures regarding needle stick and what these facilities have to go through. So I know you guys have adapted using this for some time. You've helped create some of the better benefits of this Guardian needle. So we're going to talk about that a little bit, but I really need to get a better handle on some of the specific risks with needle stick in the OR for patients and technicians.
Right. A big risk of needle sticks is always going to be biggest is going to be the risk of bloodborne pathogens. When you have a needle stick, you're exposed to any kind of bodily fluid, primarily blood, from the patient that could be contaminated or not. And so we have this risk of, Hep B, HIV, other bloodborne pathogens that could occur. And there's also a risk of infection as well. And so when you have these needle sticks, they can be very very time-intensive, labor-intensive, and financially intensive. Just because you're having to come back for rapid treatments or testing to make sure that your blood is still clear, things like that. The patient also has to be tested, so there's a component for the patient as well. There's also the risk of if, say, someone gets stuck and then a patient accidentally gets stuck by that dirty needle, then we run the risk of exposing them as well to something, we could be carrying that
Sure.
we don't know of. So there's a lot of risk involved in needle sticks. So.
And I would assume there's a lot of hesitation too. If that happens once, then coming back in for the next case, there's going to be hesitation again. So you're
Yes.
overly concerned about it, or you're kind of pulling back on it.
Yes, you're very overly cautious the next time, and the surgeons and the staff especially, after a needle stick occurs, especially with one of ours, they're very reticent around our needles because we do have to cover a patient pretty much head to toe with needle electrodes, and the surgeons, the staff, everybody is positioning this patient, grabbing them right where the needles happen to be. And so there's a huge risk that they're going to get stuck, and they're very well aware of that, especially after they get stuck once.
True.
Yeah.
So is this has this changed or dramatically changed the workflow that you guys have in surgery?
I know that our surgeons and our staff, they feel extremely comfortable with these electrodes. And for us, it's really been beneficial that we've been able to give them that reassurance that, these are, finally a safety needle. Every other needle in the OR has a safety component except for neuromonitoring. And finally, we have one that we can offer that sort of reassurance for.
What do you think are some of the challenges, in the neurosurgical market, especially in the neurosurgical suite, the environment and the market, that helped kind of develop this Guardian needle? As we went forward, besides the needle stick was one, but maybe just the size, the scope of it, the effectiveness of it.
Yeah, well, some benefits that we really push for and enjoyed is the self-adhesive aspect of it. It helps hold it more securely to the patient than just our normal method, which is place the needle, slap a piece of tape on it, hope for the best. So that's been really, really beneficial. And additionally, having there is a lovely window in the actual mechanism there that you can see your needle. So you can actually visualize, is my needle in the patient or is it out? And when it's out, okay, I need to be extra careful here. This needle has come dislodged. But at the same time, you're safer now because you still have this protective sheath around it.
Great. So we have some product here today. Some of our Guardian needles, our first gen and our second gen that we want to show you guys. So the first generation is with the adhesive on there. So Lindsey, can you kind of explain placement of this, how it goes in, and ease of use?
So all you do, you peel off your adhesive here, grab a hold of your little sheath here and slide it on in, and then adhere it. Obviously, it sticks to skin much better than it sticks to silicone. So, but typically it would lay nice and flat. For the other one that does not have the adhesive, same but different, goes straight in like that, but stays sheathed. Upon removal, you just grab it and pull out. The needle is still in its sheath. Same thing with this one, just like that.
And it has that window so you can see the insertion point, making sure that the needle's going into your patient.
You can absolutely confirm needle is in. You can't see the needle in the sheath. Upon removal, you can confirm your needle is there and safe.
It's flexible and it folds back into the sheath, and then you just discard it after into sharps containers.
Yes.
For these Guardian needles, how many needles do you actually use on your patient during surgery?
It's really common for us to use anywhere from 40 to 60 needles, depending on the procedure and what we're doing. So at any given point, we could have, 40 to 60 points that a surgeon, a staff member, someone could be stuck. So these have really, really reduced that for us, I think. So.
Yeah, that's a lot of needles.
Yeah, it
to
is.
Go in and then pull them all out and then having to keep track of everything,
It is.
so there's no stick. So even if there's a stick or a poke, then you basically have to stop what you're doing, go through the protocol.
Yes.
On anything for anybody that's in the OR suite.
Yes, right? Yes, absolutely. You have to go through, anesthesia has to go and pull blood. The person who was stuck will have to get in touch with employee health or possibly go to the ER to get blood drawn as well. So it's very time consuming, and takes up a lot of time away from our patients paying attention to the surgery. So we want to minimize that as best we can. Besides
the surgical cases, the next evolution of this product, where do you see it going in the future? More surgical cases? Would it go on more neuro cases, ortho cases? Or where would you like to see it go?
I could really see this going in a lot of different areas. I think this could be used in a variety of specialties, especially in surgery. Right now, I think its best application is in surgery, just given how much a patient has to be moved, manipulated by staff members and everything. So there, like I said, there is that increased risk during surgery. So I think all kinds of specialties use neuromonitoring, whether it's neuro, ortho, ENT, vascular, and needle sticks happen in all of these specialties. So being able to bring these to the forefront, I think, in multiple different specialties at multiple different hospitals would be extremely beneficial.
You see this becoming like a standard of care going forward, in moving all the other needles out of the hospital setting?
I could foresee it becoming, standard of care so long as there was evidence to show that, it did reduce sticks. Anecdotally speaking, I don't have hard data to support it, but anecdotally speaking, since we have implemented these at our facility, the only needle sticks that have occurred so far have been with non-Guardian needles, so non-sheath, non-protected needles. As of today, I have not had a needle stick with a Guardian needle.
Amy might not know this, but what's the percentage of needle sticks that go unreported?
Gosh, I don't know an exact number, but I would not be surprised to hear that it's high. I feel like they're very vastly underreported.
Yep.
Just for the sake of how much they involve, as far as how much work has to be done. For people taking care of themselves. Unfortunately, people don't want to report when that happens. So if we can minimize it, it's better.
True. Yeah, and there's a big financial aspect of that as well. Having to come back for constant testing, shots, the hospital, the person might have to take time out of work,
exactly.
all of that. So there's a big financial aspect as well as a personal aspect of it, and a confidence in what you're doing going forward.
Yes.
So I really wanted to sit down with you and talk to you about how it's changed the workflow in the OR from what you guys were using in the past. So any benefits, and even go into some of the needle stick protocol that you guys had, and if this is helping with that as well.
Yeah, I think we're seeing less needle sticks with it. As far as I've been doing this for 9 years, I've been in the OR with spine patients for 9 years, and I have, over the last couple of years that we are using it, I've seen less needle sticks with it, with putting them in and taking them out. It really has decreased the needle sticks and our protocol in the rhythm of how we do things. So when we have a needle stick in the OR, it really causes a workflow change because we have to stop what we're doing. We have to draw blood from the patient, and then there's a length of time that we have to wait to get back those results for whoever was stuck. So now we're seeing less of that, and so that's a huge process change. And at the end of the case, instead of having to wait till the very end of the case to pull out all of these needles, our neuromonitoring techs are able to take these needles out and safely count and see all of their needles and know that they have what they had at the beginning of their case, and know that they're safely able to remove their needles without risking themselves or one of us at the surgical field.
Cool. So we're talking about the needle stick protocol. So can you explain a little bit about that? So if you're in a case and you're moving the patient, then you have a needle stick. Do you have to stop the case? The techs leave, or how does that?
So the whole case doesn't have to stop, but anesthesia does need to draw blood from the patient. So that does normally require that they have to do a new IV line or a new stick on the patient themselves, and then draw blood. We have to send it to the lab. And then whoever was stuck has to fill out a form, and then it has to come back to them whether or not, the patient has something. And then it's a waiting game, and there's all kinds of nerves and everything. And so with these newer needles, it's not as much of a waiting game, and those processes have decreased and a lot. And so the risk of the surgical team and the neuromonitoring team is decreased on those sticks tenfold.
Yeah, so it sounds like that the it's more efficient, obviously, in your workflow, but that there's a reduced cost, without having to go through all that extra you guys have to do now. So
yes,
and you're using these mostly for your ortho cases.
Yeah, we use them in ortho and neuro. We use them for spine cases where we need to do stimulation around the spinal cord. So laminectomies, scoliosis, and tethered cords is what I personally see them used mostly.
And then once you're finished with the case, then removal is a lot faster and a lot easier. And is there a policy a procedure for that as well?
Yeah, the neuromonitoring techs usually take them out themselves, and they're able to take them out faster at the end of the case and pull them out while we are still in the process of closing the patient's surgical incision, instead of having to wait until all of the surgical drapes have come down. And that helps with decreasing the amount of time that the patient is under anesthesia.
Yeah, and that was a question I was always thinking. Is it helped with Is it helped with the difficulty on the pediatric cases using something like this versus your other needle, and the time it takes, for insertion and then takedown at the end of the day?
Absolutely.
Yeah. So I appreciate your time. I know you got to get back into the OR.
Yeah, absolutely.
So,
thank you.
Yeah, thanks for coming by. All right, so we're here with Dr. Brian Saway, Neurosurgical Resident. So I appreciate you taking time out of your Friday and your caseload to come down and chat with us about the Guardian Needle. So I wanted to get your perspective on the changes in workflow by using this needle in the OR. Really on your perspective, has it benefited the cases you've been involved in? Has it given you kind of a better peace of mind when you're going in there and you're working with these patients?
Sure. Well, first of all, thanks for having me. It's been incredibly exciting to see this innovative technology be brought to our operating room. As neurosurgeons, we're constantly using neuromonitoring. It's an incredible tool that allows us to protect the nervous system while we're doing these delicate surgeries on patients. And while it's an amazing tool, there are risks to it. And one of them is having to place a needle into our patient's body. And there's a big risk for poking yourself, especially as neurosurgeons, we're trying to act quick, we're trying to operate quick, we're trying to get through cases quickly. And that often involves us having to manipulate the patient, move the patient from bed to bed, having to get the patient's head or spine positioned correctly. And during all of this process, there's this risk of us getting poked by these needles. So previously, it was really just an unguarded needle that was going into the patient's body that could easily come out and easily poke us.
Sure.
And it happened more often than we like to admit. But now that we have this new technology, it's been really incredible. You just feel safer as a surgeon being able to go through your workflow of getting patient positioned, starting your surgery, finishing, and knowing that the neuromonitoring is not being affected by this new technology. We're still getting great signals. And then being able to take it off quickly without having to, again, risk anyone in the OR getting stuck.
True. Yeah. And as you mentioned, there's a whole protocol for in teams of risk management, infection control, getting involved in needle stick.
Yeah.
So as a surgeon, if something like that occurs, you have to stop what you're doing. You have to go through all these functionalities of helping the technician or the nurse or whoever's involved in that, and then go back in with the patient again. So the efficiency of this, like you said, in the workflows has definitely changed for you guys for the better.
Certainly, and it's very interesting because of how serious we take needle sticks in the operating room. Almost everything is very highly guarded, and there's technology involved in every aspect of a needle or something sharp in the operating room. But it's been fascinating to see that neuromonitoring leads have not kind of evolved and changed with all of the changes that have happened. So this is a technology that's needed to be brought into the operating room. And again, I'm just a neurosurgery resident that's been blessed to see this brought into the operating room, and I have no investment in this, but it's great to see because, you see all the different protections like butterfly needles, different ways to get IV access. All of those have safeguards in them to protect the provider, but this previously didn't. So I think this is just a really innovative technology that's going to help patients, it's going to help surgeons, it's going to help everyone in between who's in the operating room.
Cool. So we're talking about the Guardian Needle and thoughts on standard of care going forward for other facilities. We're seeing different facilities now pick this up and bring that in, to their surgical suite. There's been some papers through the OSHA guidelines on bloodborne pathogens and using safety needles. So a lot of hospitals now are saying even third-party companies are coming in. So it seems to be taking hold.
Sure.
Do you see this as something that should be standard of care going forward?
I think that's a great question. If you see in the operating room, like I was saying before, it seems that every other sharp needle has some safeguard to protect the surgeons and all the operating room staff, but this neuromonitoring needle doesn't. Here there's an opportunity to protect people. I think if there's an ability to demonstrate evidence that it does significantly protect and decrease the amount of sticks, I think that it should be a standard of care. Definitely.
I agree. Now, you're also involved in some research aspects of this as well.
Yeah.
Can you explain kind of what you guys are doing with it?
Yeah, so we here at MUSC, we've collaborated the neurosurgery department with our neurophysiology department on several studies. One of the studies we're really honing in on now is using contrast-enhanced ultrasound, which is a specific type of ultrasound to visualize the perfusion of different neural structures. And specifically, we're looking at the spinal cord, and we're using it as a way to augment and hopefully enhance and build upon our neurophysiology and our neuromonitoring that's happening in the OR. So we're always using neuromonitoring, but being able to understand the perfusion in a visual aspect is what we're studying, and being able to use the neuromonitoring in a safe way, we're now integrating neuromonitoring into more of our cases. And I think having that safety of this needle is a good step in the right direction.
Absolutely. Yeah, it's interesting. You look at something as basic as a needle and the design of it, and you say, where else can we use this as we go forward? Whether it's in more surgical cases or even in something else, in a neuromonitoring case. Could you see this needle being used other places besides the OR, or maybe a version of this being developed for somewhere outside of the OR?
Yeah, certainly. Specifically in our patients that are in the neuro ICU, that are in medically induced comas or in different states of sedation, being able to use neuromonitoring in that aspect, I think, would be of great utility. I think from our perspective as neurosurgeons and as staff on the floor, we are certainly worried about a unguarded needle that's in a patient that could potentially be moving if sedation's not optimized, or if someone's not familiar with this. But if we had a needle like this that we could safely place on a patient on the floor, I think we could get really profound and significant data that would alter how we're treating patients on the floor, and we'd feel safe as practitioners doing that. Mm-hmm. I think right now we don't. Yeah,
that's true.
Yeah, exactly.
But yeah, and then that goes with the peace of mind of going into every case or anytime you're interacting with the patient, knowing that there's a safety needle on there, because you said the protocol is what you have to do once a needle stuck once you get a needle stick, is really is very costly, and there's a lot of time involved in it.
Oh yeah, I've had it myself. I've been stuck before, and you're finishing a long day of being in the OR from starting at 6 a.m. and then potentially finishing at 8 p.m. If you get a needle stick, the way you have to end your day is then going to the emergency room, getting blood drawn, going through this long, arduous process. So not only is it financially, there's a financial aspect to it, but just from a time perspective, from having our time be valuable, being able to prevent this and being able to go home.
That's right.
Nice.
Yeah, at a reasonable hour.
Yeah. And of course, protecting our health, because there's risks with getting stuck by needles.
Yeah, absolutely. Well, I think that's all the questions I have for you today. So I appreciate you coming down.
Of course.
Taking time out of your schedule. I wish you luck on your residency program.
Thank you.
Hopefully, after you're done, you stick around. If not, we'll see you again at another location.
Yeah.
So
thank you, sir.
Thanks, sir. Okay, we want to thank Dr. Barley and her amazing staff here at the Charleston Pediatric Hospital that we spent time with discussing the Rhythmlink Guardian Needle. We got some expert opinions, some great analysis, and some demonstrations. So if anybody has any questions or concerns, or they'd like to reach Rhythmlink directly for more information on the Guardian Needle and our different variations of the needle, you can look us up at rhythmlink.com.